Hi, yes, this is validation 3 and I will be demonstrating NG tube insertion, irrigation and discontinuing. Okay, so the first thing I'm going to do is insertion. So I check the doctor's record for NG tube, the physician's order for NG tube insertion, and I also have to make sure I check the patient's record for any allergy and check if the patient is nothing by mouth, and do my hand hygiene, get all the equipment I need for the process, come into the patient's room, knock, knock, knock. Hi Jane, how are you doing today? Okay. Oh, my name is John Paul. I'm going to be a nurse today, okay? And yes, you have a doctor's order for NG tube insertion, and have you done it before? Okay, all right. So, could you please help me confirm your name and date of birth? Okay, can I have see your armband? Okay, that's good. All right. NG tube is just a little tube that will be inserted into your nostril, down to your nasopharynx, and down to your stomach. Okay, and it's gonna help to, because of your vomiting, uh, it's gonna help to decompress your extended stomach, and to also suck out unwanted gastric secretion. Okay, all right. Yes, I understand that you might have a little discomfort at the cost of the procedure, but I have a glass of water here that gonna you be drinking it at the cost of the process to make sure, to smoothen the movement of the tube. Okay, all right. Do you have any question for me? Okay. Are you having any pain? No pain. Okay. And should I go ahead with the procedure? All right. Okay. Just can I call? Please, can I call one of my colleagues to come and assist me here? All right. Hi, Amanda. Please, can you help me with NG tube? All right. Come back. So I have to perform an hand hygiene. We put on my gloves, take the bed up, position the patient in a high Fowler position, and yes, he's going to stand upright in a high Fowler position, and yes, uh, get this cover, make sure the gown is not stained with any secretion, get my bowl in case he's going to vomit, and yes, and I have to assess my patient and make sure he's, assess the bowel sound, assess, check the vital signs, check if there's any difficulty breathing, check his breathing status, respiratory status, and after assessing my patient, so I'm gonna go ahead with the procedure. So I'm gonna do remove my hand gloves, wash my do my hand hygiene, put on a new glove, new clean glove, then get my NG tube apparatus here. Okay, so what I'm gonna do, measure it from the nostril to the earlobe, from the earlobe down to the xiphoid process, and extra 1 to 2 inches. And I'm gonna tape it with my tape. Okay, after taping with my tape, then I have to measure, to lubricate the 1 to 2 inches, 3 to 4 inches of the tube. Hi Jane, I'll be starting the process, okay? All right. Can you help me take your head up? Okay. And I'm sorry, okay? Sorry, I'm sorry. So once I get to the nasopharynx, turn it 180 degrees and get my patient down. Please, can you help me get your head down? All right. Okay. Then I begin to insert it. So while I'm inserting, I have to give the patient water to be drinking to make sure it goes down very fast. And while I'm inserting it, I have to assess my patient to make sure, there's no difficulty breathing, no coughing, and no gagging. And yes, get to the point of then tape it to the nostril. After taping it, Okay. The next thing I'm going to do is to check the tube placement using depending on the company policy. Then maybe by using X-ray or gastric secretion or auscultation. Yes. So after verifying the tube placement, and here I think I need to cover this because this is the pigtail, exactly where inflow of air, and this inflow of air is actually going to help to prevent any vacuum in case if there's any adhesion between the stomach lining and the gastric tube. So I have my anti-reflex here, covered with my anti-reflex. Yes, and so the next thing I'm going to do is to connect it to the suction based on the physician's order. Connect it to the suction. So after connecting it, yeah, and I will have to assess my patient and make sure he's assess my patient bowel movement and make sure he's assess his tolerance for the procedure, and I also have to assess my patient for check his comfort. I have to make sure he's comfortable, no vomiting, no nausea, and no difficulty breathing, and also have to make sure that the bed is not less than 30 degrees. The head of the bed is not less than 30 degrees. And what I'm going to do is to clean up my patient and make sure to do the oral and nasal hygiene and clean up the table. And after cleaning up the table, clean up the bed and everywhere, and lower the bed down and raise the handrail, remove my hand glove, perform hand hygiene, and go and chart. And I have to chart the length, the time of the tube insertion, the length of the tube inserted, and also have to chart the type of tube placement, and also if there's any secretion I have to chart it up there. And that is it. Please, Jane, this is the call light here, so use it and call me, okay? Do you want me to get anything? Nothing. Okay, thank you very much. Use this line and call me if you need me, okay? And I'll be back to check you again, okay? All right. You comfortable now? All right. Okay. Have a nice day. Bye. Go out. Come back for my irrigation and check the doctor's order for irrigation, and also check there is no allergy, and check the type of irrigation to be done, and come into the patient's room, gather all the equipment I need, come into the patient's room, knock knock knock. Hi Jane, my name is John Paul, I'm going to be a nurse today, okay? Yes, and you have a doctor's order for NG tube irrigation, okay? And please can you help me and tell me your name and the Robert? Okay, can I check your handbrand? All right, and yes, so what I'm going to do, I have to provide privacy for my patient and raise the bed up and make sure patient is not less than 30 degrees, and perform hand hygiene, put on hand glove, okay, and I'll be removing I'll be irrigating your NG tube, okay? All right, discontinue from the suction. Okay, so after discontinuing from the suction, I have to make sure I assess my patient for any nausea. Do you feel any nausea or vomiting? Okay, bowel movement. Okay, you have good bowel movements. All right, all right. I have to check my patient bowel sound, and after doing that, I have to, check for tube placement, and in verifying tube placement, I have to, check the through if there's any aspirate. Okay, suck it out. Yes, seeing some gastric aspirate, push it back. That's good, but then cover it. But if there's no gastric aspirate coming out, I have to use air bolus of 50 millimeter. Go back again. Listen to the bowel sound. Using my diaphragm of my stethoscope, and push in the air bolus, and I'll hear the sound of the air bolus that are going to rush to the stomach. Okay, getting this out. So I have to get 30 millimeter water to flush it. After flushing it, I'll draw it out a little bit to check the gastric secretion. Push it back again. Okay, cover it. So the next one is remove my anti reflection, and take 10 millimeter of air, dry air, put it here, flush it, remove, return it, close up my anti-reflex. Okay, do you feel alright? Okay, assess my patient and make sure he doesn't have any difficulty breathing, and yes, so I have to connect this thing back to the suction. By connecting it back to the suction. Okay, so yes, make sure the bed is not less than 30 degrees. Assess my patient, make sure he's comfortable, no difficulty breathing, and he's fine. And I have to go lower the bed down and raise the handrail, remove my glove, do my hand hygiene, go out and chat in the contents of the aspirate, and they also have to chat in the difference between the instilled fluid and the aspirate, the difference in the input and the outtake sheet. And also have to chat in the type of placement. Yeah, yes, go out, come back again for discontinuing. Review the medical order, the doctor's order for discontinuing the NG tube, check allergy, come to the patient's room, gather all the equipment with my hand hygiene. Knock, knock, knock. How are you, Jane? How are you doing today? Okay, you have a doctor's order for your NG tube discontinuing, okay? All right. Do you have any question for me? All right. Should I go ahead with the process? All right. Thank you. And have to provide privacy for my patient. Lower the bed down. Take the bed up, and raise the head. Remove the rail down. Do my hand hygiene. Okay. All right. So inspect my patient and assess my patient and make sure there's no difficulty breathing. And do you feel any nausea or vomiting? Okay, make sure my patient is comfortable, and go ahead, remove the suction here. So once I remove the suction from discontinue the suction, and the next thing I'm going to do is to grab the tape. All right, I'm going to be drawing this in out now, okay? And I would like you to hold your breath now, okay? While I'm drawing this in out, okay? All right, hold your breath. 1, 2, go. Thank you. Use this pad to hold it and make sure the gastric secretion do not stain the patient down. And after I finish removing it, yeah, the next thing I'm going to do is to take this and trash it and clean up my patient and make sure he's comfortable, and assess my patient and make sure he's comfortable, have a good bowel movement, no difficulty breathing. After assessing my patient, I'll ask him, do you have any questions for me? Okay, all right. I'll lower the bed down and perform an hand hygiene, but I will make sure in the tube, I'll make sure there is no, to check if there's any blood stain, blood secretion in the NG tube. So do my hand hygiene, go out there and chart the time of removal, time of NG tube discontinuing, and also have to chart the volume of the type of secretion, gastric secretion observed, and yeah. So and that's it. Chart everything, and that will come the end of the validation. Thank you. So I'll ask my patient, this is a call light, so call me if you need anything, okay? All right, go.